Good morning, everyone. Today I would like to talk about something that's affecting millions of people, patients and healthcare workers alike. And no, it's not a new disease. It's burnout, and it's a major problem in Canada's healthcare system. Imagine working 12-hour shifts, constantly being short-staffed, and dealing with an endless stream of complex cases. That's a day in the life for many healthcare professionals, and it's taking a toll. The pandemic made things even worse, pushing burnout rates to unprecedented levels. Over 50% of physicians and nurses are now experiencing burnout symptoms. If we look back 20 years ago, burnout was still a concern, but it wasn't as widespread. The healthcare system wasn't dealing with the same level of strain as it is today. So what happened? Well, population growth, an aging population, the explosion of technology in healthcare, and increasing paperwork have all contributed to the pressure, and now the crisis is very real. Looking ahead 20 years, we have two possible paths. On one hand, if we keep going down the current road of underfunded healthcare, understaffing, and high expectations for workers, burnout will become more of an epidemic. On the other hand, if we take action now by addressing these issues, improving work-life balance, and using technology to reduce stress, we could create a healthier, more sustainable healthcare system. I'm optimistic, but the future depends on the steps we take right now. Picture this. You're a doctor, a nurse, or any healthcare worker. You're the person everyone turns to in a crisis. So, when you're struggling, asking for help might feel like you're failing your team. In healthcare, resilience is often praised to the point that it can silence people's need for support. This makes it harder for workers to admit that they need help, and it keeps burnout from being addressed. We need to start a conversation where it's okay to say I'm struggling, and where seeking help is seen as a sign of strength, not weakness. There is good news. There are services out there to help. Across Canada, organizations like the Canadian Medical Association and the Canadian Nurses Association are offering resources, counseling, and wellness programs. These are vital lifelines for those who need a break from the pressures they face. Locally, many provinces have their own initiatives. In Ontario, for example, the Ontario Medical Association runs a physician wellness program, providing access to therapy, peer support, and even workshops on building resilience. British Columbia also has the BC Nurses Union, offering mental health support and wellness hotlines. At the federal and provincial levels, governments have started taking action as well. The Canadian government has increased funding for mental health services and awareness campaigns. Provinces like Ontario and British Columbia are investing in programs aimed at addressing burnout, recruiting healthcare workers, and improving work conditions. But let's be honest, the support is still fragmented, and there's a long way to go. So, what needs to happen to improve things? First, we need to hire more people. It's not just about throwing the money at the problem. We need to fix the staffing shortages and reduce workload so healthcare professionals aren't working at 110% capacity every single day. Second, we need to keep breaking the stigma. Let's make mental health support normal in healthcare. We can't have a culture that says, if you can't handle the heat, get out of the kitchen. We need a culture that says, we've got your back. Lastly, we need to embrace technology in a way that lightens the load, not adds to it. AI can help streamline paperwork, telemedicine can connect patients and doctors more efficiently, and electronic records can reduce the administrative burden. So, to sum it up, healthcare burnout is a major issue in Canada right now, and it's been building for years. But with the right investment, the breakdown of stigma, and systemic changes, we have the opportunity to make the future brighter. The road to fixing burnout is challenging, but it starts with you, advocating for change, supporting our healthcare workers, and ensuring that we create a system where they can continue to care for us without sacrificing their own well-being. Thank you very much.